Okay, well, it's a cardiac rehab service that we provide, but within that service we run a nurse-led cardiac clinic. And really what that clinic encompasses, it's reviewing patients that have come into hospital with a cardiac condition. Initially started off with being strictly the post-MI patient, but as the years have gone on and as our clinics expanded, we now sort of take the majority of patient groups that we see within our rehab service. So it will be post-MI, it will be unstable angina patients, and on some occasion elective PCI patients.
So do you take heart failure, congenital heart, or are you fairly focused on what you do?
We're fairly focused on the groups I just identified. Yeah. Obviously within some of our patient groups, some of them will have heart failure as part and parcel of their event that they had, initial event. But we do have a particular heart failure service that really deal with ongoing management of heart failure patients.
So can you take us through what you and the team do, you know, almost on a day-to-day basis in relation to clinic, how the work's divided up, the skills that you use in your clinics?
Okay. Well, essentially our clinics run once a week, and we basically divide up that between 2 or 3 of us. What that involves is reviewing approximately 7 patients per clinic. Within that we need to just review their medical notes prior to clinic, and within that clinic setting we feedback any test results that the patients have gone through, review their symptoms, and basically assess their progress on the back of that. If there's any problems that have arisen within that assessment, then we can refer on the patients on for further tests or discharge them from our clinic.
So in terms of your almost preparation for that role, I know we were talking off camera about sort of courses and bits and bobs. As a team, how do you develop and keep up to date? Is there a degree, a master's? Are you doing courses? How do you get yourself to where you are competently?
Okay. All of us who are within the cardiac rehab service have got a cardiology background. Obviously within that there'll be different people that have done different levels of courses in preparation for that. Me personally, myself, I did a cardiac degree, and we have been in attendance at various conferences that have been there to really sort of help set up nurse-led clinics. My colleague Helen and I went down to London to have a conference about that. As really beyond that, really, it's just really been a learning process where we've been guided by our consultants through it as well. Because when we first started out the clinics, a lot of our stuff was run by our consultant on the back of it. But as it's progressed over the years, it's we still have to sort of ask our, speak to our consultants about putting people on angiogram lists or etc. But it's really been just a confidence thing that's grown over time. And
I wondered about that multidisciplinary working. I mean, you obviously, I presume you all get on. Has that been a natural progression? Is there, I'm just wondering, the interface between other disciplines, not just medicine, but you've been accepted and been able to develop, or has there been rough times with other disciplines?
To be perfectly honest, we've actually had a fairly smooth road for the development of our clinic. When we started our clinic, it really was on the basis of patient need. A lot of patients were waiting maybe 7-8 months for the cardiology review from the consultant. A lot of our client group are fairly young, and it was, often they weren't being allowed to return to work until they'd had their clinic review. And so we stepped in, and we see our patients really approximately 8 weeks post-event. So it's a nice timely review for them. And really, the consultants' confidence in our clinic has really grown, and we've taken over probably the majority of any sort of post-ACS care for our patients, and really the support has been overwhelming, really, from everybody. We obviously liaise very closely with our physio colleagues because we work in cardiac rehab, are referring on to other disciplines, for example, the dietetics service. There's been no problems with that, and really relations through all sort of the multidisciplinary team. That's a difficult one. Has been great. There's really not been any huge problems. And in fact, it's been so much supported that actually our consultants would actually love us to actually take on more of the patient groups, to be honest. But it's just limitations set within how many pieces we can split ourselves up into, because obviously within rehab there's lots of different areas that you have to support as well.
An odd question, Zanna, nurse prescribing or independent nurse prescribing, is that something that any of the team do or would do in the future? Is there a place for it?
Absolutely. Well, I personally am a nurse prescriber, and there certainly is a place for it at clinic. Traditionally, often what we do is recommend to GPs from our discharge letter what they should be doing, because ultimately it's their patient at the end of the day. But we still have the ability that if we need to get somebody started on a particular medication, we can actually do that at clinic. But certainly it's very a useful skill to have, and gives you lots of flexibility.
How did you find the course?
Very onerous, time-consuming. I don't know whether it was the best option to do that one at master's level, because it was quite a big course in the first place, even at degree level. But at master's level, it took up a lot of time, but valuable course to do. Yeah.
The other thing is about evaluating the service, because everybody says, are you making a difference, measuring effectiveness. And again, we were talking a bit off camera, there's always a way to do things, but things happen in reality, as you go along. How's evaluation been? Are you doing it? And, just tell us a bit about that.
Yeah, well, that, as you said, off camera, we discussed a bit about that. And right back at the beginning when we set up the nurse-led clinic, evaluation wasn't something that was built into that setup. And I think if anybody was to try and set up a clinic now, that would be a good thing to do. And, as time progresses, although that's something you should be doing, getting pulled in all directions, time often isn't there to actually do it. We've had some relatively informal evaluation of clinic of medical students, maybe doing a little sort of thesis on our clinic and a review, which was useful. But we are very aware that evaluation and formal audit of our clinic is something that we're really keen to drive forward, in the not too distant future. We certainly have made contact with clinical governance within the hospital, are really keen to help support us doing that. But we know in this day and age that, a lot of what service you provide has got to be evidence-based and audited, so we have to, that is a big driver of what we've got to do next within our clinic setting.
And that's all I want to ask.
Okay.
Thank you very much, Zanna.
Welcome.